So Dr. Apurva want to consult with you. So if you allow, then shall I join her?
Sure.
Yeah. Hi, doctor.
Hello.
Actually, I have the one question. Like, my grandmother collapsed in her village and was taken to the city,
Mhm.
where doctors found bleeding in her brain for a reputed blood vessels. They performed emergency brain surgery to stop the bleeding.
Hmm.
Then can you explain what happened and was surgery the right choice since we had no time to decide?
Yeah, I mean, I think your question is a little broad. I'm assuming, based on the story, what you're telling me, your grandmother is elderly, has collapsed. If she collapsed with an intense headache, likely, like, she could have suffered bleeding in the brain, which is could be hemorrhage, which could be hemorrhage in the brain, which is intraparenchymal hemorrhage, or which could be a subarachnoid hemorrhage, which is from rupture of a small aneurysm, what we say like bulging of the blood vessel inside the brain. So if neurosurgeons have performed the surgery, what it means is probably she's completely comatose, I guess, right? So they want to like make sure they want to stop the bleeding. Then likely whatever you're describing is probably she might have had an aneurysm rupture, uh, and the modality of treatment is they go through the catheter, and they block that blood vessel which is leaking through putting some coils in it, and that is the mode of treatment. And if the bleeding is into the brain tissue, primarily because of rupture of smaller blood vessels, then the treatment is to prevent excessive swelling. Uh, they could have probably put a small ventric to relieve the pressure, or uh, based on what you're describing, I'm thinking like if uh, there are like recent trials which says that they can evacuate the hematoma, especially they have to meet certain criteria. So needless, if your grandmother was comatose and was not in a condition, and if the bleeding is so massive, and what it describes is probably they could have secured the aneurysm, and they could have stopped the bleeding. So probably that is the right choice by performing the procedure.
Yeah, doctor. So I think Apurva, you got your answer to your query.
Yes, yes. Thank you, doctor. Thank you.
Okay.